next, in our speed dating afternoon, we are going to welcome, I believe, Dr. Agnes, there she is, Agnes Binagwaho. Hi.
Hello.
Good to see you. Haven't seen you for a while, and we're reaching you in Kigali. Is that correct?
Absolutely. I'm talking from my home in Kigali.
Wonderful, wonderful. And one of the interesting things, and I should mention that we're talking now with the former health minister of Rwanda, a real global leader in health, and a pediatrician by training originally. Is that correct?
Exactly.
Yes. And one of the interesting things about where you are in Kigali is that Rwanda has really put a lid on spread of this virus, unlike where I'm sitting in Washington. And obviously people are incredibly interested to know what the secret is of Rwanda's success. It's all provisional success. Things could always go badly, but so far, at least, Rwanda has got a handle on this. Can you talk a little bit about what's going on there that maybe we haven't seen in the United States?
You are right. So far, we have in Rwanda only 201 confirmed cases of COVID-19. 93 have already recovered. 114 are still active cases. And so far, we have no deaths. And we have made it in Rwanda by using evidence-based approach backed by science, learning from our past effort to prevent Ebola, but also from success and failures of the pandemic response across the world, because we know that the global response will be as strong as the weakest country, and the pandemic are just outbreaks mishandled. We need to use the expertise that exists all over the world and to learn how to share it quickly on time. We know also that the vulnerable are the most affected both by diseases and prevention measures. Even in rich countries like your country, for example, in New York, where the virus is killing Black and Latino people at twice the rate as white people. It's not a racial weaknesses. These people are vulnerable because the condition where they live. And against that, the society could act. It will be better for all. And because of this knowledge in Rwanda, we continue to apply two pillars of our health policies, an equity approach and a multi-sectorial approach. This means solidarity and decentralization. Strict isolation, for example, protect all and can only work if all have enough food for their family, which is hard when you no longer have an income because of the lockdown. The central government and the local government then have to organize distribution of food and social support for people. So the Rwandan success is proof that you don't need to be rich or have large scale of resources to successfully prevent the spread of coronavirus. You just need to take the time to provide simple and accurate information to the nation, to fight misinformation from inside the country or outside the country, to take evidence-based decisions backed by science and on time, and to develop trust, solidarity, and social support. This is what we teach at the University of Global Health Equity.
Right. Talk about that a little bit more, the government communications program. I'm very curious about that. Literally, how often does the government communicate with people? What is the level of scientific technical qualities of that communication? Give us a more complete picture of how that communication is going. I'm asking for an obvious reason, which is that we have in America right now an idiosyncratic approach to the dissemination of information from the highest level of the federal government.
So in Rwanda, our president just come and give us the high level of line or where we stand with other countries, etc. Regularly, there was a great press conference yesterday. Every day, the Minister of Health issue the number of people infected who have recovered and new cases and the number of tests that has been done during the day, and also where the new cases are coming from. Now, what we have as level of information, I think that the world understand that what is a virus, we discuss, because we have other virus, so we build on previous knowledge, but also what we do, and probably what is quite unique to our country, is that in the preparation, and we were prepared early January. We start preparing and testing everybody at the airport mid-January, 1 month before the first cases. The first cases in this country was the 14th of March. And everything was ready to be rolled out at the minute of the first test positive. The people who test know who to announce it, and etc. So that means at the moment, the Minister of Health issue a communique. At the moment, that moment, all schools, churches were locked down. And because the preparation was done with all churches, they had airtime on TV and radio for their office, for each religion of the country, and all the head of religion were part of the discussion before. So everything rolled out smoothly. The media were also informed about what is the disease, what can happen, what will be done if the country was affected by the pandemic, etc. So the parliament, the media, the local government, the civil society, the private sector, everybody was briefed before with the role of each and every constituency well established, and everybody knowing what the others are going to do. So this is the level of information.
Well, let me ask you this question about Rwanda. Rwanda is many things, and the government is generally considered to be extraordinarily competent. But Rwanda is not a democracy, does not have the same democratic traditions as the United States, the UK, for instance. Does it help that Rwanda doesn't have, that the people of Rwanda don't have the same democratic rights as other peoples? Does it help that the government is more all-encompassing in its power?
Okay, let me rephrase your question like I would like to be asked.
And then I'll ask the way I just did. Go ahead.
So, first of all, I'm raising against what you say. We are a democracy, meaning everybody vote, and if you go in all, not now because there is a lockdown, go and ask who didn't express his desire to have the president we have, and his desire for him to stay, and why, and we know why. Now, the democracy you have, I'm so sorry. For me, if I found my country more democratic than yours, because you have a country where Black people like me have problem to vote when they don't fight for it, where people are mistreated and killed every day without more than we have in my country. What you should reflect on, what is the definition of a democracy? Where your democracy has been hijacked through emails and Facebook. So I want you to be a little bit less arrogant on the definition of what democracy means, and leave the Rwandan the choice that they have done. So, I agree with you. I agree with you that we have a strong government, cohesive government, working like one. And also this help, because you are so disorganized. And when I say that we need to avoid misinformation, we need to have a common language to talk to the nation and to protect the nation, you didn't reach that. And maybe this is something you miss.
I'm more than happy to talk about, and I have been talking about, the failures of the American government response to this crisis. It doesn't absolve the Rwandan government, and obviously, I don't think that that Rwandan dissidents and media representatives are being arrogant when they criticize aspects of the way Rwanda is governed. And my question is, because this goes to a larger question, there is this debate about whether democracies are better equipped for handling a pandemic or more authoritarian style countries. And you might have a view on that. I'm pretty sure that we've done this before. I'm pretty sure that we're not going to come to a meeting of minds on this. I will give you another opportunity to talk about it if you want. But
Yeah.
I'm also interested in asking you about the World Health Organization, because you are a
But
senior.
to come back to your previous question, Jeff, I just want to tell you that in my country, if somebody go and give information to people that can harm them or kill them or put them in danger, you face the law and you are accountable to that. Maybe this is also something different.
No. And that I understand. That is based in the very special and tragic history, recent history of Rwanda as well, where your country had an early, let's call it a relatively early experience in mass disinformation and the consequences of the perpetuation of mass disinformation. I totally see that point. Let me ask you about the World Health Organization. You're a senior advisor to the Director General. President Trump has cut off funding to the World Health Organization. Saying that they covered up, they're incompetent and covered up what was going on in China. Without agreeing with Donald Trump, would you agree that, with some of the criticism of the World Health Organization, that it was too soft or too slow on the question of what was going on in China at the time?
I think no, I disagree, because a pandemic as a definition, all countries can come together again as the General Assembly of the World Health Organization are the Minister of Health of all countries and redefine what pandemic is, but they didn't delay. And how come that the countries who are really hit badly by the virus had the same information than countries that did well? So I think it's the way the information are used, the information given by the World Health Organization is used by the country, and the way the government are listened to the scientific inside and outside the country, that make the difference.
Let me ask you one other question about your relations with the United States. And I asked Prime Minister Brown this a little while ago. The world is used to American leadership. My question to you is the world going to be would the world be a better place if America weren't looked to for leadership? Or now that the world is not looking to America for leadership, is that actually making the global effort more difficult? I guess I'm asking you to sort of place America now on a spectrum of global leadership.
So we all know that in the way forward, in the future, the balance will not be the same. What it will be exactly, I don't have a strong idea on that. But the role that the government of your country have played now, like if you go out of WHO, you can go out of WHO. WHO will survive and continue to advise people. You just roll back from a leadership position you could have. So this will change, yes. And the rest is, for me, I don't mix the government, your government, and the people of the US, because my best friend are in your country. The best brain I know are shared globally, but you have everything you need. It's just not used for the moment.
Right. Are we talking about Paul Farmer, perhaps?
We talk about Paul Farmer, but we could talk also about the thousands of great minds you have in the National Academy of Science. I talk about all your universities so well staffed by great brains that are underused because the science is not on the front of the decision taken in your country today.
Right. One final question for you. You're the Vice Chancellor of the University of Global Health Equity, great institution. And I want to focus on the last word of the title, equity. Do you think that this pandemic is going to lead to more nationalization, what Gordon Brown refers to as vaccine nationalism, for instance? Or do you think that this might trigger a different kind of global conversation about what equity means? About resources that are provided to sub-Saharan Africa, say, versus the United States or Europe. Do you think that we're at a pivot point, or do you think we might just go back to the way things are or were?
This will be the choice we will make in a couple of months when the world will wake up from this pandemic. This pandemic has shown us that without solidarity, without caring for the vulnerable, you just delay the good response of all the means you put to fight the pandemic. When I told you that what we do here work only because the vulnerable who doesn't have enough food on daily basis are cared of by the central and the local government. This is what we call equity. The future will not redefine what equity is. In the future, the world will decide what they are ready to spend on equity or not. And if we go back to the former status of the world, we are going to lose a lot, because this is just a warning. We are going to have many more outbreaks that will be mishandled, turned in pandemic. And if we don't count on solidarity inside your community, like inside your family, inside the country, inside the region, the reaction will be even worse. We need to develop solidarity and trust.
On that heavy note, it's an important point to make. I want to say thank you very much. Always fun talking to you and arguing with you, Agnes. Dr. Agnes Binagwaho, one of the leading forces in global health, and we're very, very glad to have had you. Thanks so much for coming.
And Jeff, thank you. You are among the great brain in this part of the world.
That's what my wife always says. Yeah, that's what my, yeah. All right, bye-bye.